Let's get started by going around the table, and we'll introduce ourselves as we go. I'm Dr. Kathy Gloyd, President of Elevate DVM. Joyce?
I'm Joyce Logan with Zoetis. I'm the medical support for our chronic pain products, dogs and cats.
Okay. Tammy?
Tammy Grubb at Washington State University, and also a consultant with pain management and private practice.
Right.
Ralph Harvey, anesthesiologist, University of Tennessee for many years, and now chair of Veterinary Advisory Group for BioTraceIT Corporation.
Okay. Margaret?
Margaret Gruen, behaviorist, veterinary behaviorist, and at North Carolina State University.
Great. And Mike?
Mike Petty, and I am a private practitioner, and I own a pain management clinic in Michigan.
I want to finish up by giving each of you a chance to answer the questions about the take-home points that you want to make for veterinarians and the take-home points you want to make for clients. Let's talk about the veterinary ones first, and take it as you think of it in whatever order that you would like to. If you have a veterinarian watching this video, what is the one or two points that you absolutely want them to walk away with?
I'm going to tag on to Ralph's, and that is not to be afraid to medicate. How many times do we hear veterinarians say, and owners too, but to me the veterinarians, we should know better, say, oh, I don't want to give it any drugs. I don't want it to have drugs. So meaning like pre-visit pharmaceuticals or in-hospital sedation or whatever, like where does that come from? This is, you know, like you said, medication really is often the answer. And for an anesthesiologist standpoint, because I like to sedate not everything, but most things come to us to be sedated. But you know, I said this in my lecture yesterday, and I totally believe it. Sometimes that is what is needed for the fear-free visit. You have to sedate that animal. That is a fear-free visit. This isn't a last resort kind of thing. So if they need it, and we've got a lot of good tips of getting them to the point they don't need it, but if they need it, medicate. Whether it's pre-visit pharmaceuticals or sedation, or like meropitant came up, if it's anti-nausea medicine, whatever they need, don't be afraid
to use it. All right. Who else?
And I'll build on that and on something that Mike said, is don't be afraid to regroup, to stop and think, do I have to do this today? Or can I send them home, and not be afraid that clients will think that you're not a good veterinarian because you couldn't get it done. Actually, the message you're giving them is, I care more about the welfare of your patient and your pet, and I'd like this to be as easy on them as possible. So can they go away and come back with that pre-visit medication on board? But really being able to kind of time out, because I think we're very busy, we want to get this done, it's easy to get frustrated, so be okay with just stopping and regrouping.
Okay.
I'm going to add one, having, as we discussed earlier, being on the other side of the table now, not being in practice, but bringing my animal in for treatment. You cannot over-communicate with a client. Sometimes we think they know that we're trying to be gentle, or we're trying to do things, but we don't tell them what we're doing. We don't necessarily explain the process, and they don't realize that maybe some of the things we're doing actually are for the benefit of the pet, and we don't recognize it, but we need to tell them why we're doing things. Or as we talked about earlier, yes, we're taking them to the back, what Ross had said, sometimes you do need to, and letting them know why we're doing it. Not just we're taking them to the back to examine them because it's easier. We're taking your dog to the back because we think it's actually less stressful. But just explain things to clients as they do it, because otherwise they'll fill it in with their own thoughts, and what they're thinking is going to be way worse than what you're actually doing.
I'd like to tag on as an owner to what you were saying, and that is pain management should not be optional.
Right, agreed.
Don't present me as an owner with a litany of all the things you're going to do, and let me make the decision as an uneducated owner that you should manage my animal's pain. That should no longer be part of our discussions at all in veterinary medicine. Mike.
Well, I think my comment, I'm just going to make one, and it's both for veterinarians and owners. And You know, again, having done this for 40 years, I've seen a lot of animals in pain, and I've seen the effects of that. I've also seen the fact that many times animals are not presented for pain until it becomes a problem for someone other than the animal. And, you know, it suddenly can't go outside to go to the bathroom. It can't use the stairs. Maybe the veterinarian sees, you know, a painful, you know, hip manipulation, but they've already just talked to the owner about dental cleaning and heartworm prevention and so forth. And do I really want to add one more thing on? My point is that I think we should, do we really want to accept things as they are, or do we want to do things as they should be? And I think that is a really important take-home message.
Mm-hmm. I think for those who are either new to the fear-free agenda and movement and those who are just starting to consider it, sometimes we'll feel like, well, this is a collection of the obvious. And when I had my aha moment and realized that there are better ways to do things and the things that we should be doing, it was all like, oh my goodness, of course. Now I understand. And I think this is sometimes the application of principles and techniques that should be and can be obvious to us. But you know, so was sterile technique. And sterile technique in medical and surgical procedures revolutionized medical care and surgical care. And the application of these techniques and these standards to reduce stress and suffering is not just a collection of the obvious. It's a menu from which practitioners and people in the veterinary profession and owners can pick and choose. So it may be that some techniques on the list in the menu will be things we're already doing in our hospital. And other techniques, other things on the list, well, maybe that's a good idea. And then I can implement one or two. And all of a sudden we see an improvement in our interaction with animals, less conflict. And then we decide, well, I'm going to implement this. And we find what fits in our own practice, in our own home, to initiate the fear-free principles and reduce that constellation of pain, anxiety, fear, and stress.
Right. And I think, sorry, just one more that builds on that as well, is that, and we've said it before, but just as a take-home, that when we think about multimodal therapy for pain, addressing fear, anxiety, and stress has to be part of that multimodal therapy.
Yes.
Can I add one thing on top of that? Which is, and it doesn't have to be difficult. These can be added in. It doesn't have to be expensive, and it doesn't have to be remodeling your hospital. These things can be done.
Excellent point. What about to the clients? What key message do you want to give clients about fear-free, pain-free, and the intersection of the two?
I think the message is that they are part of the team. Welcome to the fold. Here's a link to Fear-Free Happy Homes. Here's the Happy Paws publication. Here's where you can find it in the grocery store or the bookstore. And we rely on your involvement to help us diagnose chronic pain, osteoarthritis. We rely on your involvement to help us accomplish the administration of these medications, whether it's authorizing us to use the long-lasting monoclonal therapies, for instance, or helping you help us find the right vehicle to get your animal medicated, and then interact with us in chronic pain care. Keep a pain diary, you know, that binds them to our hospital, and we partner with the best clients. So I think my message to clients is that thank you, and we need you, and we need you part of the team. And if we're going to implement a more gentle care of our patients with less conflict, we only do it through our partnership with our clients.
I would like to tag on to what you said there about the partnership, instead of us feeling like we're on one side of the table and they're on the other, that it is truly us sitting on the floor with our pets and talking about that care. But also to what Mike said earlier, I think that many veterinarians, particularly now that we have so many specialty practices, that if I am a particular specialist, I treat that animal, or if the animal comes into a general practitioner, I deal with what's in front of me. But so I think that sometimes pain gets taken down to the last level, and I think that we need to, as the owner of an animal, be proactive about managing the pain if our veterinarian is not. That's because that's what's bothering them at home, is that changed behavior. And that is what we need to make sure we are addressing, not just their skin condition or their cancer or this, that, or the other. So we've got to make it move it up in the list, I guess, to make it important as an owner. Margaret.
I mean, I don't have much more to add on to that, just that I think when we talk about education of owners, we are really talking about engagement of owners, and that those two always go together, that we cannot do it without them, especially something like chronic pain in cats. We are not going to see the same thing in the clinic that they're going to see at home. And so we need to help them know what behaviors to be looking for, but we need to get them engaged in the health care of their pet. So just really to add on to what Ralph said.
Tammy?
Yeah, I think we all have the same message, just tagging on that they understand, they're looking for those behaviors, and they understand that so many of these problems are manifest as behavior. So back to pain, they don't see pain. They see what behavior that patient expresses because of the pain, and oftentimes that is fear, anxiety, and stress. And back to the noise phobia study, those patients had chronic pain. So just understanding that some change in behavior is a reason to come to the veterinarian, and maybe it's fear, anxiety, stress for another reason, maybe it's pain, maybe it's obviously both, since those go together. But just making them understand that, helping them understand that a lot of the things they think are just aging change are not just aging changes. They're a development of some anxiety. Maybe it's a cognitive dysfunction. I think owners are not aware, many are not aware that as animals age, they may develop cognitive dysfunction just like people. So getting them in and getting them assessed by a veterinarian who practices good pain management and fear-free strategies.
Because I do think it's true that if you try to treat one without treating the other,
Right.
you won't get as far. And that musculoskeletal pain and noise phobia is a perfect example, where if you don't address the pain, you're not going to be able to resolve the anxiety. And if you don't address the anxiety, you're probably not going to be able to really address the pain. So the interplay is really important.
I agree.
Joyce.
I would add, if I think about from the consumer side, from the client side, it has to do with the visit does not have to be scary, stressful, awful. There are clinics out there that are paying attention to this, multiple clinics that are paying attention to this. The profession is paying attention to this. We're all learning together. So don't write it off as it used to be, that it used to be the rodeo of corralling an animal to just get it vaccinated. This is evolving. We're working with you, and it doesn't have to be bad.
Bad experience. Mike, would you like to close us out?
No,
Any further words?
Nope. I'm just happy that we had a chance to all come together and talk about this very, very important topic.
Absolutely, very productive. The fear, anxiety, stress, pain thing, I think, is a message we really, really need to get out there, and I think we've discussed a lot of important topics.
I want to thank you all. You've done a marvelous job, and it's been fascinating to me to be part of it. So thank you for coming, and thank you for being part of it.